This is Healthcare Now Radio's Interviews Now. Thank you for joining us. I'm Shereese Maynard, today's host. Follow our show with the hashtag Interviews Now and join the conversation. In this fast-paced, ever-changing landscape we call healthcare delivery, who can we trust to tell us, good or bad, what's happening now? Let us help you sort out these issues with today's thought leaders in the know. On this episode, we'll be discussing the patient experience with our guest, Dave Dyell, President and CEO of Jellyfish Health. Dave, welcome.
Thank you, Shereese. Glad to be here.
Now, can you tell me a little bit about your background and how you ended up in health IT?
Sure. I've been in health IT about 25 years now. I actually started my career working on a med-surg floor as a nursing assistant on the night shift, and was always just amazed that my nurse managers were doing all of their schedules on little tiny index cards while we had an IBM computer sitting in the back with a dust cover on it. So I'd done some programming back in high school, so I decided to, sit down one night and actually wrote a scheduling system for them. And IT, obviously came around and said, you can't really do that unless you work in IT. So I took a job in IT and I've never looked back.
Now, can you describe the role Jellyfish plays in the health IT space? Specifically, where do you see gaps in the ecosystem related to the patient experience?
Well, I think the thing that folks have to really think about is the way that patients today want to be interacted with. And what patients are really looking for is more of a single and a consolidated, consistent, but more importantly, digital view of their healthcare journey. And so when they look at a health system today, what they see is kind of what retail used to provide, which is a multi-channel, separate and disconnected enterprise, right? It's why if we go to a primary care office in a medical office building and then go down 2 floors to the lab, they don't know about us. They don't know about each other, and we have to repeat, something as simple as filling out a form. What patients really want is an omni-channel experience, which is what we get from, vendors like Amazon and et cetera today.
So what you're describing here in patient experience, it was supposed to be accomplished through patient portals. We all remember how that was going to be the new shiny thing. What makes your platform different, and why does this difference matter?
Well, patient portals are great for sharing information with patients, but they don't really interact with them, right? They don't really understand preferences. They don't really understand the way that patients prefer to be communicated to. And oftentimes they're only sharing information after something has occurred, not necessarily during it. And so again, if we take a look at that concept of omnichannel, think about back when, online shopping first started. I remember my wife actually buying something from JCPenney and trying to, take it back to the store and return it, even though she'd bought it online, and then telling her that she couldn't, because again, it was disconnected. It's that same problem with portals, right? If you go to, your primary care office and they're using one portal, and you go to the hospital, then that physician may be employed by, they may be using a completely different portal inside of that laboratory or inside of that radiology department or inside the main hospital. And so those 2 channels are just not connected and they don't share information. So then I, as a patient, now have to manage multiple portals and have to move back and forth between them to try to get that single view, which is not what I want, right? I want to be able to go to, like I do Amazon, click on order history and see everything I've bought, regardless of whether I ordered it on my Alexa, whether I ordered it on, my phone, my computer. It shouldn't matter, right? It should all just be in one place.
That certainly makes sense. And as a patient, I've actually experienced that, and I'm sure a lot of our listeners have. Dave, do you come from a retail background?
I don't.
Okay, because a lot of what you said makes sense. And really, when I was in college and grad school, I did retail management, and I brought some of that to healthcare. And some of the things you say are some of the conversations I've had with individuals about how we could take a lot of lessons from the .com of retail and that type of thing, and trying to transition some of the healthcare ills we have to the, from that environment.
It's true. And again, we've tried to learn, right, as much as we can. When Patrick and I started the company, we really wanted to, not reinvent the wheel. There are so many great examples out there of companies that have figured out, how to treat a consumer correctly, right? And there's all kinds of tools and processes that they've done. I mean, something as simple as, the text message from a check-in, right? Think about, the last time you went to dinner. Most restaurants now understand that, you want to walk up, give your cell phone number, and go walking around the mall. Right? Because if you're walking around the mall and you're shopping and you're interacting with your family, your friends, and you're laughing, you don't feel like you're waiting.
Exactly.
But when you're just standing there in a little doorway, right, all crammed together, looking at the hostess, wondering what's going on, then you feel like you're waiting.
Hmm.
So it's kind of funny that healthcare still has people just sitting in a waiting room for hours
Exactly
with
right.
no idea what's going on. It makes no sense, right? Makes no sense.
Exactly. Yeah, and it's I always say the unwritten contract to wait. So I understand how the patient experience is better with Jellyfish Health versus a portal, but can you share a bit more about why this matters so much to hospitals?
I think the thing that we have to understand first and foremost is who is a hospital's customer, right? It used to be for a long time that the customer was a physician group, right? They needed to go out and recruit physicians to be able to get the patient population. Physicians recruited to each other because, again, they wanted the referrals and they wanted those patients to choose, those individual providers that they had relationships with. That has changed. Now the consumer is really the patient, and they are the ones that actually have to be marketed to. And just like any business, if you don't build loyalty, then you're going to have to continuously go out and try to attract new patients or new customers, right? So loyalty is really now the new driver behind, hospitals and health systems having to really reach out to patients. And so if they think about it, like from, again, a retail perspective, if you can build that loyal base, you're going to get more repeat customers. That's going to drive your revenue and your overall profitability over the long term. So that's really what we're seeing right now is hospitals and health systems understanding that patient experience is the new loyalty.
You mentioned specific needs in rural healthcare to build patient loyalty. Can you share any examples of patient feedback your rural healthcare clients with our listeners so we can understand what you mean by that?
Sure. It's interesting. A lot of times when we're talking to rural organizations, they feel that somehow this digital experience doesn't necessarily apply to them. But what we found is actually it's one of the areas where it's the most important. As now some of the larger inner city health systems are starting to reach out into their rural neighbors and trying to build capacity to again take away some of their market share. Patient experience is one of the ways that they're going to really be able to compete. And this argument that somehow the patients themselves that live in those areas don't have smartphones or of the age that don't want to use digital technology, it's just really not true. We actually have a client that is, in Vidalia, Georgia, the Meadows, health system, and they, literally have, lots of very rural, patients who love the technology. One of the most shocking findings probably has been that the best adopters of this are actually women over 60. So
Right.
It's been really interesting to see, every one of those, kind of misnomers be put to rest in that single implementation. And I also think it's important that, rural providers understand that from a patient's perspective, that time is just as valuable to them, right, as it is to somebody who's living and working in a big city, sometimes even more so, because for some of those folks to actually make it to their health care, they may have a longer drive. They may have to make a commute, right? There may be other considerations that providing that transparency and really giving them an idea of, how long things are going to take are all that more important. Think about how frustrating it would be if you got in your car and drove an hour, to receive health care only to find out that the appointment had been canceled or it's delayed 2 hours. And, those frustrations get much larger when you now add, that additional, option of time, into it. So it's really important that we think about rural healthcare as well and the importance of building loyalty there.
And I think you bring up a valid point. It also allows for greater opportunities when you're considering social determinants of health for that particular population of rural citizens.
It certainly does. I mean, there's no question that, chronic disease is not limited to a city setting, right? It
Right.
goes across, every aspect of this country. And I think it is just as important to focus on, those folks in those areas to make sure that they get the benefit of the best patient experience as well.
That's amazing. If you're just tuning in, you're listening to Interviews Now on Healthcare Now Radio. And I'm talking to Dave Dyell, CEO of Jellyfish Health. And I understand that Jellyfish, and I'm actually a little fascinated by it, you've had particular success with building the patient experience for centers of excellence for like cancer care centers or obstetrics. Can you tell our listeners a little bit about that?
Well, I think the thing, again, that is interesting is a lot of times people think that patient experience is related only to one aspect of healthcare or to a single channel. And it's really not, right? It really is, again, that patients have, sometimes chronic diseases that they're managing. They may have multiple comorbidities that they're trying to manage across those different disease states. And so it's really important that the health system understand that consistency of experience across every aspect of care, across all of those channels, is also just as important, right? I should know that regardless of which channel of that organization, whether it is obstetrics, whether it's cancer, regardless of what I'm going to go interact with that organization on, it really should drive that exact same experience across every one of those.
Right. So Dave, one term I've heard in patient experience is a patient experience map. Can you explain what this is and how Jellyfish Health works with its clients to build one?
Sure. So the patient experience map is really the concept of providing transparency to a patient in regards to what their journey is going to look like for that particular day. So think about it, it's probably analogous best with package tracking, right? The package tracking industry has done a wonderful job of giving us all complete transparency from the moment we order something to where it's at and then when it's going to actually be delivered to us. Patients should be able to have that exact same level of transparency on their healthcare journey, right? When I schedule an appointment, I should then be able to be reminded about that appointment. I should then be able to, on the day that I check in, immediately be shown that here's the 5 steps I'm going to go through today. I'm going to see a registrar. I may then have to go talk to a financial counselor. From there, I may go and actually see a nurse. I may see a doctor. I may have a treatment. Whatever the different steps are I'm going to go today, show those to me. Help me understand what's going to happen. And also help me understand how long it's going to be between those tasks or how long each of those tasks might take so that I can then plan and take control of my life, right? As a parent, I remember distinctly sitting in the doctor's office, looking at my watch. It's getting to be 2:00. I'm the one who's supposed to be picking up the kids at, school today. So are they going to be standing out in the pickup line? Do I need to, text a friend and try to get them to go get my kids? Do I need to text my kids and tell them to go to aftercare? All of that anxiety and buildup that happens to us because we don't know what's going on, right, is completely eliminated with the concept of an experience map. Instead, we really show the patient that transparency, and then they really, can manage their life accordingly.
Wow. I think all of our listeners could appreciate that. Okay, so let's talk about the future. What's your vision for Jellyfish Health, and how do you think your company can push the patient experience envelope in healthcare?
For us, what it's really about, as I said, is getting to more of a personalized conversation around what a patient's digital health really needs to look like. It's about saving those patients time, making every step of that journey the most efficient that it can. It's why we think one of the unique things about our platform is that we don't just focus on patient-facing components. There are a lot of folks out there that are trying to solve, different pieces and parts of patient experience, and they're very focused on that consumer, but they forget about one fundamental, thing that they should be thinking about, which is if you actually show up to an appointment and you have a bad experience, does it really matter how easy you made it to schedule or how transparent you made the process before they get there? If when they get there, the experience is bad, it's irrelevant, right? So for Jellyfish, a big part of what we focus on too is helping the caregivers themselves realize how they can be more efficient to make sure that we can, provide that patient the best overall outcome. And I think that's where you're going to see Jellyfish continue to evolve. We're going to continue to expand our portfolio of things that are going to happen again before the visit, during the visit, and after the visit to just continue to make that process more efficient. Because again, if we can give that patient back time, we make their life happier, right? And if we can give the providers, that time back, we actually make the process more efficient for them as well. They get to go home and actually have dinner with their families at night instead of working late because they're closing up, the last few patients. They get to actually maybe even see more patients because of the fact that they actually are more efficient now and have more capacity. So those are the things that Jellyfish is going to continue to push the envelope on, is really making that overall process better for both the patient and the provider.
Well, it sounds like the future is bright, Dave. I want to thank my guest, Dave Dyell, for joining us today. To learn more about Jellyfish Health, find them at jellyfishhealth.com or visit them at HIMSS 19 in Orlando this February. They'll be in booth 1069. And thank you for tuning in today. For more information about Interviews Now, visit our show's program page on healthcarenowradio.com. And until next time, if it's happening in healthcare and it's now, it's on Interviews Now.